Hello, everyone. Welcome back to the Mass Retirees Weekly Update. Today's Friday, November 21st. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, I'm joined by a special guest who is familiar to all of you, I certainly hope, Nancy McGovern. We are going to talk this week once again about healthcare and specifically healthcare affordability and some breaking news that just developed yesterday at the Group Insurance Commission's November meeting. But before we get into any of those details, let me first remind you that today, Friday, the 21st at 11 a.m., we will be hosting our final area meeting of 2025. We'll be out at our Central Mass meeting in Auburn. Again, it kicks off at 11 a.m. Mass Retirees meetings are open to all Mass Retirees members. You're welcome to bring a guest. We'll serve light refreshments. Door prizes will be drawn at the conclusion of the meeting for those of you who are in attendance. So if you're in the Central Massachusetts area today, come on by. The full details of the meeting location and all of the pertinent information is always found on page 3 of our newsletter, The Voice, in this case, the October newsletter. But it's also contained in the weekly email message that comes out every Friday morning at 6 a.m. It's sent to all Mass Retirees members. So if you're looking for details on today's meeting or any future meetings, please look to our weekly email message or the newsletter for that information. We also have one final teletown hall meeting taking place this year. It will be held on Thursday, December 18th. This meeting was supposed to have taken place a week ago today, in November. We have postponed that meeting for two key reasons. The main focus of this meeting was intended to be on the pending report of the Special COLA Commission, which is anticipated to file its report in the coming weeks. So we want to make sure that our members fully understand all of the aspects of that report. And as a reminder, our association president, Frank Valeri, is your representative on the 9-member commission. So that will be the main focus of our teletown hall. However, recent developments in terms of healthcare at both the state and the local level are extremely important. So we also want to make sure that we take that opportunity to update all of you of what's happening with your health insurance, give you the opportunity to ask us questions. And because the GIC will be meeting, its next meeting is scheduled for Thursday, December 18th at 8:30 in the morning, we will have information literally hot off the presses that afternoon to share with all of you. And as always, our teletown hall meetings kick off at 1 p.m. Full details will be provided in the coming weeks in our weekly emails. There are a couple of different ways that you can join. The easiest is simply answer your telephone at the time of the teletown hall. You'll receive an auto connect phone call from us. Just pick up the phone. You'll be automatically connected to the teletown hall. But you can also find the toll-free teletown hall number printed on your Mass Retirees membership card. So with that, let me jump into the news of the week, which again is focused exclusively on your health insurance. As important as the cost of living adjustment is to all of you, we believe that your health care, the ability to access high quality and affordable health care is just as important. And as we have been talking about for really the better part of the last 3 years, we are growing increasingly concerned with what we deem to be a healthcare affordability crisis, not just here in Massachusetts, but really nationally. Now, 2 weeks ago, Nancy and I attended the annual conference of the Public Sector Healthcare Roundtable. The roundtable met in Washington, D.C. The roundtable is a collection of public sector health plans. I believe 40 plus plans from around the country participate in the roundtable, everything from Massachusetts all the way up to Alaska, believe it or not. I'm not sure if the state of Hawaii, Nancy, participates or not, but
No.
that would be a long trip for them. But it's an annual meeting. It's the health plans and their executive officers. And Nancy and I have participated in this conference now for the last 3 or 4 years. Quite honestly, it's one of the best conferences we attend, just in terms of the information that we receive. And the ability to learn and act on what we learn. Now, the Group Insurance Commission is a member of the roundtable. Matt Vino, the executive director of the GIC, participates in the conferences. And as a matter of fact, this year, he actually served on a panel making a presentation on GLP-1 medications for weight loss. Matt was joined by the head of the Texas Teachers Health Plan. And a senior executive from Eli Lilly, which of course is the manufacturer of a couple of the more popular or prominent GLP-1 medications. And coincidentally, as this panel was making their presentation, less than a mile away at the White House, President Trump, along with other executives from Eli Lilly and senior administration officials, were making a presentation on steps that the Trump administration is beginning to take to help lower the cost of GLP-1 medications that could potentially lead to this class of weight loss medications being made available for the first time on a wider scale to Medicare enrollees. Now, while the details of these plans are still being put together, it's something we're very closely monitoring. It's an encouraging step that the federal government is recognizing the value of these particular class of medications and is continuing to take steps to try to lower the cost of drugs. Now, if you've been a member of our association for a while, you know that we have been closely following not just developments here in Massachusetts when it comes to healthcare, but certainly at the national level as well. And in addition to Matt's presentation, we had 2.5 days of really intense education from a variety of speakers, a variety of topics, all related to healthcare, and in particular, the focus being on public sector healthcare, which is super important. And while every single presentation was important and we certainly learned something, there were a handful of presentations that for us were even more important than some others. And I want to turn it over to Nancy to kind of walk through just a couple of examples of the presentations that we really thought had some particular value for things that we're focused on here in Massachusetts.
I think, as you said, there was a lot to digest coming out of those sort of 2.5 days. I think that sort of big themes around rising costs, navigation around complex conditions, in particular like cancer, and sort of how public sector plans are going to address these pressures. Sort of two of the other sort of the smaller kind of presentations that are more laser focused on issues. One was around cancer care and how we approach cancer care. We heard from the American Cancer Society and Cancer Navigator, which are two leading organizations in the field. And they shared some really sort of startling trends and reports coming out of the cancer care area. And they had indicated that, half of cancer patients don't get the optimal expert for their diagnosis. And it's a huge gap. And they provided some examples on how to potentially better connect patients with the appropriate oncology location for their particular diagnosis. The American Cancer Society, which I'm not sure, I didn't realize, we know that they're out there, right, that they're providing services, but the wide range of tools to support folks, I think was sort of really eye-opening as part of that presentation. They have the CARES app, they have clinical trial matching, transportation help, lodging support, and they have all these planning guides and resources, and they're both open to caregivers, the patient, as well as employers to be able to provide resources for their employees. I also do want to highlight, they weren't part of the presentation, but they are somebody that we have sort of connected with and begun working with, and hopefully maybe can develop a partnership here locally, is Color. And they are also partnering with the American Cancer Society. And Color has built about a 50-state medical practice and they serve about 7 million patients. And their focus is on making, cancer screenings and follow-up care accessible for larger populations. And they're doing a lot of work in the retiree and labor and public sector space. I think one of the takeaways from that presentation for me was really sort of that navigation matters. And if we can kind of guide folks to the appropriate care and they're supported by good data and they have strong partners, there's always better outcomes and there's better value for the public sector employees that are employers that are providing the benefit, right? And I think so. One of the other presentations, which is always a big topic of discussion around a PBM and transparency and accountability, and it was a focus of a large piece of legislation here recently in Massachusetts. And the presentation was done by CalPERS, which is the largest pension system in the country. They represent about 2 million members. And so they actually just sort of went through a PBM contract, and they have a new model that they presented as part of this. And it really showed what a large purchaser can work with and make an impact on the PBM space. So those two were really really interesting discussions, I think, as we look for areas to be innovative in cost containment here in Massachusetts and within the local level as well.
Yeah, that was one of the interesting things of hearing, what's taking place in other states. And while it's troubling that everyone's facing the same concerns and struggle with cost containment and affordability and trying to make sure that the best possible benefits are being provided to our collective membership at an affordable price. Even states like California that insure several million members and are exponentially larger than the GIC, even they are somewhat hamstrung in terms of how they can contain costs. And while innovations are being made, and as you just said, on the PBM model specifically, there are lessons to be learned that can translate to, for instance, what the GIC is doing. Even they are struggling with some of these, and it's going to take a national, a collective effort here, both at the state level and even more importantly at the federal level. But that doesn't mean that we're not going to try to do things at the local level, to improve the situation for all of you as best we can. We can't wait for Washington to act. We can't wait for other states to act. We have to be proactive on our part in continuing to work closely with our partners, whether they be in the labor movement, the insurance companies. As all of you know, we have a very close working relationship. I would even say friendship with Blue Cross and Blue Shield and WellPoint, just to list two examples. We work extremely closely with the Group Insurance Commission and Matt Vino and his team. This is a collective effort around the state. Nancy on a day-to-day basis is in direct communication with our folks at the local level, whether it be the public employee committees, the IACs, local union leadership, covering all of the bases to make sure that you are well represented. And to shift the focus back here in Massachusetts, because again, it's an affordability crisis that we're facing. That crisis is being compounded by the fact that we also have an emerging budget crisis underway. And there are really three main drivers of this moment in time that we are going to feel this increased squeeze at both the state and the local level. And again, not just here in Massachusetts, but this was a common theme at the Roundtable conference. Every single state, every single municipal government across the country, to varying degrees, is feeling the same budgetary pressures right now. Now, at the state level here in Massachusetts, both the legislative leadership as well as the Healy administration has taken a very cautious, conservative approach to budgeting. We started to see that about a year ago as the FY26 budget came together. It was a very much bare bones budget. And the fear is that for FY27, we're going to see significant belt tightening and cuts. I mean, there's really no way to get around, belt tightening really equates to cuts. And one of the exercises that the Healy administration has asked across state government, in addition to the hiring freeze that's now been in place for, I think, Nancy, about 6 months, if not longer, um, is that every single state agency, whether they are a direct state agency or an independent state agency like the GIC, has been asked to come up with options as to what steps could possibly be taken, things to put on the table for consideration to cut costs and to save money for FY27. And to be very clear, the GIC at their meeting yesterday presented a series of options. These are not proposals. These are not anything that the GIC is saying that we should adopt X, Y, or Z. It's simply options that were presented to the 17-member GIC commission that will be further discussed, I believe, in great detail at the meeting on December 18th as to what levers, as Matt Vino characterized it as, are legally available to the GIC that if they are forced to, what are areas that they could save money. Now, unfortunately, as you'll hear in a moment and you'll read in great detail in today's email message, in our opinion, the majority of these options equate to nothing more than cost shifting. In other words, making you pay more money out of your wallet for the same services that you're receiving right now. Now, over the last 7 years, the GIC has done a fantastic job of managing those costs. We have not seen any widespread or really any changes whatsoever in terms of increases in copayments and deductibles. And we do not want to go back down that road. In our opinion, you are already paying too much, certainly enough, if not too much, for the health insurance benefits that you're receiving right now. And by forcing you to pay more, that is only going to result in a growing number of retirees and active public employees not being able to afford to access your health insurance, not being able to afford to fill a prescription, to go to the doctor, to get a test done, to have a procedure done. You're going to be forced to put it off. And we know studies have proven that that's only going to increase costs down the road, which is going to cost more money over the long run. So as several commissioners at today's meeting pointed out, this is simply a short-term Band-Aid approach that is not going to succeed in fixing the systemic problems that have resulted in these higher costs to begin with. But just to kind of run through some of the options that are on the table, and again, I want to be very clear, these are simply options. No decisions have been made. These are not proposals or suggestions. They are simply options that were necessary to put in place given what the state and local governments are going to be facing most likely as we head into FY27. Now, I'll let Nancy kind of walk through things and then we can talk about what steps we are going to take in the coming weeks to let our views on these topics be well known to everybody. Nancy?
And I just, I wanted to comment too, and as Matt had pointed out during the uh, meeting yesterday, that, there's a relatively long runway into making sort of final decisions about what plan designs look like, what premium rates are set, et cetera, before the July 1, 2026 implementation of the plans. And so I think it's important that, we recognize that we're having this time to really have a long and open dialogue about what that plan looks like come July of 26, right? And I think jumping off here in November, allows us that opportunity. And so some of those options that, were put out there today, right out of the kind of gate were around the plan design changes, which we know that's usually the kind of first piece and the first lever that is looked at. And some of those plan design changes would include an increase in copays on services, maybe such as urgent care, ER visits, potentially office visits. They weren't significant sort of dollar amounts that they presented, but it's still an increase out-of-pocket cost for members. Um, they did have a few options under the pharmacy category. One in particular was a removal of GLP-1 coverage around weight loss, versus what they are implementing at the first of the year, using the Center of Excellence to be able to continue to provide that benefit. The other one that we wanted to highlight that came out as part of the discussion was around the surviving spouse contribution. Um, this option would create a situation where the surviving spouse contribution would be reflective of the decedent's contribution. So if the decedent was paying 85/15, then the surviving spouse would be that. So, those were a couple of the options. There were others, more high level technical changes that could be made within networks and plans that could potentially have an impact on what premiums look like. But those are sort of the first jumping off kind of discussion points that were brought out yesterday at the meeting. So, I think we're obviously going to be taking time to reflect on those and be able to provide feedback. And I think that, I think we're appreciative, right, of the fact that we do have this time to really talk about what that looks like for folks.
I think one of the things that I want to make clear out of the chute, looking at all of the options on the table, I think the one that strikes me as the most egregious right off the top is increasing contribution rates for surviving spouses. The Commonwealth has had a tradition for many decades, probably going back 40, 50 years, of protecting surviving spouses. And one of the ways that protection has been provided is that regardless of what the retiree was paying in terms of a contribution split, like Nancy said, for instance, 85/15 or 80/20 for newer retirees, the surviving spouse would only pay 10%. And the philosophy behind this is that when you lose a spouse, not only have you lost, that loving member of your family, but in many cases, you've also lost a significant portion of your household income. And the least that the Commonwealth can do is try to alleviate part of that burden by lowering the healthcare cost burden that surviving spouse would have to pay. And this is in sharp contrast to the policy at the local level across many cities and towns, particularly towns across Massachusetts, that in some instances require the surviving spouse to pay 100% of the health insurance premium, which is just absolutely outrageous, but that's an argument for another day. So I would hope that when the GIC Commission is looking at, if their hand is forced and they have to come up with ways to contain costs and potentially cut costs for FY27, that this would be something that would not even be considered going forward. That doesn't mean that increasing office payment co-payments or the deductible on folks, doesn't also create a significant, problem in terms of affordability. Now, we should also point out that the majority of the options presented would apply specifically to non-Medicare plans and non-Medicare plans only. We're still working on obtaining further details on, for instance, some of the office payment, co-payment options and so forth, to make certain that they would not apply to Medicare. But at first blush, it appears that the majority of these options would apply strictly to the non-Medicare plans. Now, for those of you who are non-Medicare eligible retiree, as you know, we have been working very hard for a number of years to advocate for the GIC to implement what we refer to as a Medicare buy-in program. Just a few weeks ago, Nancy and I met together with Matt Vino and his staff from the GIC and senior representatives from Governor Healy's administration. on this specific topic. And while no decisions or agreements have been made, we came away from that meeting feeling optimistic that we're on the right path. Our hope is that in the coming weeks, if not months, some decisions will be made on a path forward that would enable our non-Medicare eligible retirees. And from what I understand now, there's over 11,000 of you. So the number's actually grown since the last time the GIC crunched the numbers. There doesn't seem to be any disagreement that this would be the right policy and certainly a cost saver for both you as well as the Commonwealth and cities and towns. It's just a matter of the administrative chore. That's really the best way to describe it. There's a lot of work that needs to go into enrolling all 11,000 non-Medicare eligible retirees into the Medicare program. It's not something that's easily done. It's not something that can simply happen overnight. Even if it started today, it's going to take a great deal of time to complete this. And that's why we need to make sure that it's done correct. And that's in your best interest. But the fact that it's even on the table to increase costs on the non-Medicare plans really reinforces the importance of finding a path forward on this issue to bring relief to all of you who are stuck in the non-Medicare active employee plans. Nancy, were there other specifics that we should make our members aware of at this time?
I think we covered the sort of overview of kind of the options that are potentially out there now out in the public, and we can start to kind of coalesce around conversations around those. But I think that those are sort of the levers that they are initially kind of focusing some work on. And obviously over the next several months, the GIC staff will be very busy, crunching the numbers and working through the process, as they always do, to be able to provide good data and good information to the commissioners so that they can make, strong and solid decisions moving forward for the next fiscal year.
Now, one of the things that was very encouraging at today's meeting, once the options were put on the table and the conversation opened up for comments from the commissioners, and again, a far greater detailed conversation is expected to take place at the December 18th meeting. But the initial reaction from the commissioners, and not just from Jane Edmonds, who represents the retirees, or Bobby Kaplan, who represents active employees, and she's a NAGE representative. She's the vice chairman of the GIC, and the other labor commissioners, Dean Robertson, for instance, from the MTA, they all spoke up. But what was most encouraging, I think, to the two of us and our team here at Mass Retirees were the comments that came from other commissioners who aren't necessarily always aligned with our point of view. Eileen McEnany, who used to be the president of the Mass Taxpayers Foundation, conservative business-backed group that we always don't see eye to eye on. Eileen's a good person and we've worked together over the years, but the interests of the different organizations are not necessarily aligned. She was one of the first people to speak up and question what steps are being taken to address the systemic problems in our healthcare system that are the driving forces behind these rising costs. Tamara Davis, another private sector appointee to the GIC who comes from corporate America, again, where our interests are not always aligned. She was the one that termed the options as simply a Band-Aid approach that was going to, unfairly, and I'm paraphrasing here, but burden enrollees with these additional costs while not doing anything to address the underlying causes. So that kind of feedback, and there were several other commissioners, Toby Choate, for instance, that spoke up. Anna Sorokin she's a healthcare economist, I think at Harvard, spoke up. So there's a number of commissioners who are not comfortable with simply foisting additional costs on all of you who are seeking deeper long-term solutions. So we're going to be very interested to witness what's talked about at the December meeting. But I think we're hopeful that some of the more egregious options that were presented today are never going to see the light of day. And our hope is going back to what we've been saying over the past 3 years. We need to come together collectively and find a new way to deliver high quality, affordable healthcare. The status quo is not sustainable. You can no longer afford to be paying more and more and more. The Commonwealth and the taxpayers, just like private businesses, can't continue to afford to pay more and more and more. Our hospitals, are to varying degrees having financial difficulties. So a new, better way is needed, and it's going to take all of us coming together. Now, Nancy, like I said earlier, works hand in hand with our labor partners. We have a series of meetings coming up in just the next couple of weeks with the professional firefighters and MassCop to talk about these very issues and see what we can do to work even more closely together than we normally do. And we already work super close, but it's going to take all of us getting on the same page to move this forward. And the same thing applies at the local level. Nancy, any final thoughts before we wrap things up?
No, you had commented on the fact that we all need to, come together, and it's something that we've been talking about, right, for a number of years now, and it's important that I think not just sort of our side of the table with labor and the retirees, but it's also private sector labor, right, and the companies that they work for that are partnered with them to provide benefits and our business counterparts at the table as well. So I think that that's it's going to take all of us rowing in
Absolutely.
the same direction.
Yes. Well, in the
Which always
important,
isn't easy, but
no, no, if it was easy, this would have been
yeah,
fixed a very long time ago. The important thing is that we have a seat at the table. You have a voice in this process, whether it's at the
yes,
local level, whether it's at the GIC. We are in open communication across the board with decision makers. In years past, that wasn't always the case. And, before we close, I just need to give credit, to Matt Vino and his team at the GIC, to the GIC Commission, and to the Healy administration for taking the steps to have this public conversation, to put these options out on the table well before any decisions are being made so that it's fully vetted. Years ago, that wasn't always the case. Oftentimes, the first any of us would learn of this was on the day when the votes were being taken and the decisions were already a done deal. And that didn't serve, you very well, or really anybody very well. And we're in a different time, a different day today, where I think there's a greater spirit of cooperation and working together on these issues and finding a common path forward. But with that, we're going to log off for this week. Again, if you're in Central Mass today, come on by and say hello. It's always great to see our members in person. We will have a Thanksgiving message to you next week. It won't be our weekly update, but it's going to be a Thanksgiving message from the group of us. And then we will be back to you that first week of December, which I think will be December 5th, for our normally scheduled weekly update. I can't believe, Nancy, we're already talking about December and this year is almost over. It's
I don't
just,
know where it went.
no, not at all. But thank you very much, everybody, for tuning in. We'll talk to you again real soon. Bye-bye.
Bye.